Hello, today is June 10th, and it's wonderful to see so many people back at work. You know, our hospital is a beautiful facility, and it's very large, about 1 million square feet to maintain. Just think how important it is to have all the heating and air conditioning working, the lights, the water, the paint, the windows, the elevators, the alarms, things we take for granted every day, and it is a huge job. So today, I want to take a moment and thank the building services team that takes such excellent care of the building and all of us. With me today, representing the department, are Raul Zamudio and Louie Purkart. And I know you guys don't like to have the camera on you, so thank you very much for coming. And I think it's really important to recognize all the work you do and how important you are in our safety journey. So, Louie, let's start with you. How long have you been at Silver Cross?
This July 31st to be 31 years.
Oh my goodness. And Raul?
August 23rd of this year would be 31 also.
So the two of you have both worked here for 31 years. Most of the time together?
The majority of part, yes.
Oh my goodness. And I understand that Silver Cross is sort of a family affair for both of you. Louie, how many members of your family work here?
Probably 8 or 9.
Oh, for heaven's sakes. In all different departments around the hospital?
Yes, daughter, mother, sister, nieces, some cousins, all scattered.
Well, I'm grateful to your family for being here. And how about you, Raul?
Same thing. I have a daughter, son-in-law, cousin, nieces that work here in the hospital also.
Oh, for heaven's sakes. Wow. So all in, you could have a big family picnic here. And you know, we're going to have a family picnic this summer if we hit 70% participation on the Culture of Safety survey. So that's a plug to remind people. Well, let's talk about your team. Are you trained in certain specialties, or is it just generally taking care of the building? How does that work? Louie, do you want to?
Sure. We pretty much work on everything. Cross-train on all of everything that comes in here we work on, and we all have our boilers license, high-pressure boiler license. But yeah, basically everything we touch and fix.
Touch and fix.
Yep.
You mentioned to me that in the morning you make rounds. What does that involve, Raul?
We check all the equipment throughout the hospital, because that way we can find out if it's working fine. If not, we can adjust or take care of it before we have a problem.
Before there's a problem. So preventative work. So both of you were here when we moved.
Yes.
Yeah. So this is a lot bigger. But tell me, is it easier to take care of this place, or was it easier at the old hospital?
It's easier here because it's more automated, more computer controlled. The only thing is it's more spread out throughout the campus.
Yeah.
So there's a lot of walking. The equipments are in the different locations.
Yeah.
And some of the equipment's outside, so we have to go outside more.
Yeah. I often see you out in the parking lot coming back and forth. And what would you say, Louie? What's the hardest part of your job right now?
I'd say the expansion of the growth.
Yeah.
And it's large.
It is
very large here. So.
And we're adding that whole new wing, which will add more responsibility. And those are operating rooms and have lots of needs and more elevators. Elevators, they're always fun, aren't they? Even when they're new, sometimes they get stuck. Right. So when COVID-19 started here at the hospital, did it change your work in any way? Raul, do you want to mention that?
We had to modify some of our equipment to make it safer for the patients and the staff.
Yeah.
And also try to learn all this PPE for us and for the staff and get used to wear it more, because we were not used to wearing all that.
Of course not. So you had to learn how to don all of that and doff all of that. Did you feel protected?
Oh, yes.
Okay, good. And Louie, anything you want to add on that?
I'd say when we added a lot more to our equipment rooms, like Raul said, PPE, and in case we had to go on the roofs and work on our units, a lot more stuff in there we can get hands-on.
Yeah, to make sure. Yeah. So I know your team has safety huddles twice a day. I've been to them a couple times. And what kind of things come up when we talk about safety?
Well, like I said, when we do our rounds, if we find something wrong, we let the second shift know what we found, how we took care of it, so they can keep an eye on it to make sure it doesn't happen again the next day.
Perfect. Perfect. Any things in particular that over the years you've found to be safety problems that you've fixed? I remember something about the shower seats. Wasn't there an issue? Shower benches.
Yes.
Yeah.
We went through every room and reinstalled the shower benches because they were coming off the wall.
Yeah.
So we came up with a better solution. And then the other one was all the pictures.
Oh, the pictures.
Over each patient bed, we had to remove them all and had them all refastened also.
Those were both big jobs.
Yes.
Yes, but thank you for keeping our patients safe. That really was important work. So anything you want to say to your teammates while you're on the camera?
Everybody's doing an excellent job, and
Keep up the good work.
keep up the
Keep
good
up
work.
the good work.
Yeah.
And we miss Kyle. We wish Kyle well.
Yes.
Yes, he's in our thoughts and prayers all the time.
Right.
All right, well, thank you. Thank you for being here today and sharing
Thank you.
what a day in the life is like. Thanks.
All right, thank you.
Thank you.